For all, you support Medicare for all.
Yeah.
Vice President Biden supports a public option on top of President Obama's health care law. Republicans are attacking Medicare for all as something that would take away private insurance. If you're the Democratic nominee, how do you fight that argument from the right?
On Medicare for all, it's easy. So back to the first thing I told you about me. I'm different than most candidates that are running for president right now because I have a sensibility and an understanding about how people who live in these rural red places who are Republicans see the world. I hate to admit this fact, but I have uncles who voted for Trump. Anyway, back to, so I know what's going on in their minds. So when I ran for Congress in 2005, I actually ran on Medicare for all. And let me tell you how I got there. When I was traveling around my congressional district, this was pre-Obamacare, people were being dropped their coverage because of pre-existing conditions. Their insurance company kept charging too much money, their co-pays were too high, their deductibles were too high, they couldn't afford it, and it's a life or death issue. Every issue that the American people care about are kitchen table issues. The issues that they struggle with every night, that they can't get sleep over, that they're worried about. It's when their child is sick and they don't know how they're actually going to pay for the treatment they need. I know what this feels like as a mom to have an anxiety about a child. When I saw that Theo, as a toddler, had an allergic reaction to eggs, his hands turned red, straight up his arm, he touched his eye, face blew up. I literally ran to the shower, doused him in water, gave him a Benadryl, rushed to the emergency room. I was afraid his throat would close. The one thing I was not afraid of is I had an insurance card in my wallet. I have a credit card in my wallet. Imagine every mother or father who is rushing to the emergency room who has no security and knowledge that they can buy whatever health care their child needs to save their life. That's the reality for people today. It was the reality for people in 2005. So I said to my district, how would you feel if you could buy into Medicare at a price you can afford, 4 or 5% of income, no matter what, it's always there for you. It's always there for you. They loved it. This is a 2-to-1 Republican district. I promise you, if I'm president, I can go to anywhere in this country and say, why not have a not-for-profit public option that competes with your insurer who keeps charging you too much money? Why do you think a for-profit company cares about whether you get access to the medicine you need or that second day in the hospital or that treatment that costs too much money? They don't. They're for-profit companies. They have an obligation to their shareholder, not to you. That's how the economy works. That's how for-profit companies work. It's their obligation. And so I could very sensibly say to them, let's at least have a not-for-profit public option in Medicare that anyone can buy into. They liked it then. They would like it today. I can take that to Republican members of Congress and say, let's just try it and see how it works. It will work. Now, before you build on Medicare for all the super smart people in the room who know a lot about health care, you're going to need to fix it. It's going to have to actually cover all the things families will need. It's going to have to cover vision and dental and hearing, all the things that people have to buy extra insurance to get, so make it work. Second, make sure the reimbursement rates to the hospital or the provider actually covers cost. Those 2 changes to Medicare you can build on. Let people buy in. Give them 5 years, right? Create a transition period, which is the part I wrote into Senator Sanders' bill, because this is necessary. Let people buy in over 4 or 5 years. See how many people buy in. I wouldn't be surprised if it's 60, 70, 80, maybe 90% of Americans, because more than 90% of Americans earn $100,000 or less. So just do the math. Would you like to have access to all the health care you need at $4,000 a year?
You mentioned your uncle, Senator,
You'd want it.
who supported